My father had, he had an unusual, eclectic kind of a passion. He had an osteopathic degree, he had a chiropractic degree, and had a naturopathic degree. Also, he had been trained in homeopathic medicine. And early on, many hospitals were homeopathic. The University of Michigan was a homeopathic medical school in the 20s. And one of the main reasons for having the American Medical Association was really to form a united front to kind of deal with homeopathy. The homeopathic ideals are still extant, but and are gradually coming back. But he was certainly eclectic. He chose from different disciplines, and I was aware through his observations and also through the production of a book by a man named Owen, a D.O., who had been acquainted with a Chapman, Dr. Chapman, an osteopath. He postulated the existence of reflexes existing on the anterior aspect of the thorax, on the abdomen, on the posterior aspect of the thorax near the spine, and on different areas of the body. And there was sort of a thyroid, adrenal, gonadal concept of what organs should be treated first, and it was sort of a cut and try sort of a concept. And I was aware of it. I had read Owen's book, but I was unaware of how to use it other than to, it's like cutting and trying and then see if the shoe fits, wear it, that sort of thing. And I had a young man come to see me through the agencies of a very good friend, Pat Finucane. Pat was a Dr. Chiropractic practicing in Roseville and had a patient with a very unusual sciatic neuritis. He had pain when he would stand, he would have pain when he sat, he would have pain when he would lie down, and the only relief he could get from the pain was to walk continuously. If he stopped, the pain would come back, but he took all the stuff out of his basement and sort of just lurched around the wall all night long, half asleep, half awake, to relieve the pain. And he had had good orthopedic consultation, good neurological consultation, and the rest that normally would accompany that sort of a thing. Unsuccessful and rapidly deteriorating in health, and Pat had tried adjusting and tried what he'd learned in chiropractic school without much success. And he suggested perhaps I should take a look at him, and the fellow really looked bad. And I was aware of muscle testing, and I knew that if I tested the fascia lata, I could determine how well that moved, and I knew that muscles move lymph, and I knew from the history that if moving helped it, it must be something that movement helps, therefore muscles move lymph. So I thought I'd test some muscles and see, and I tested his fascia lata muscle on the side of the sciatic pain, and it appeared weak compared to the other side, but the other side wasn't too strong either. I palpated along the area and couldn't find any lymphatic engorgement. Occasionally, if the sacroiliac joint's been out a long time, you'll feel lymphatic nodules, little fatty lymphatic nodules in the SI joint. I could find no lymphatic nodules. Now, ordinarily, when he'd be lying on his back like that, he'd have a lot of pain. He looked up at me and he says, "Thank God, that's the first relief I've ever gotten." And I said, "That's what you come here for?" And bewildered by what happened, I just decided I'd keep it up. So I said, "Now, how long have you had this? Anyone else in your family have this?" And I'm trying to find some reason to continue this. And he kept smiling and said, "Oh, it's much, much better." He went on to a very good recovery. And my secretary at the time, who's now 88 years old and still a patient and has moved up to Gaylord, Michigan, a nice retirement area up there, had a thyroid problem that she was taking about maybe 2 or 3 grains of thyroid a day, a lot of sinus trouble, a lot of ordinary thyroid patient symptoms. And I said, "You know, Charlotte, I've learned something new. The great man has learned something new. If you test a muscle, and if you do the origin insertion like I've been doing, and I tried it with her head was always tilted like this, and I would hard, heavy pressure on the sternocleidomastoid, and it wouldn't help. I said, all you have to do is kind of go like this. I had a fellow this morning, he's had a trouble for almost 6 months, overnight recovery. He's Dr. Finucane's patient. I sent him back, and he's pleased, Dr. Finucane's pleased. And I said, I want to test something. So she was lying on her back, and I said, raise your head up like that. And I did like that. I tested it. One side appeared weak. I said, now, watch the great man in action. So I tested the muscle, and I said, now watch. And I did exactly the same thing I did to the fellow earlier that morning, and I almost fractured her skull on the table. She said, that doesn't seem to work very well, Dr. Goodheart. I said, I'm aware of that, Charlotte. And she said, well, it didn't. I said, you know, I heard about a guy named Chapman that says that there are lymphatic reflexes all over the place, and sometimes for sinus trouble, they go just underneath the clavicle here. And I said, you got a thyroid problem, and maybe that's what's complicating it. So I manipulated the lymphatic reflex here and here, and then tested the muscle. The sternocleidomastoid muscle became immediately stronger. And she said, could that have helped my headache? And I said, why do you ask? She said, because it's better. How could that do that? I said, well, that's, thank you, that seems to be a new circuit. And then from that point on, what we did, we attempted to test muscles against the lymphatic reflexes, which was a very difficult task until either, fortunately, get one of those loose. Yeah. Fortunately or unfortunately, I had a chiropractor's son who unfortunately was coming down with Hodgkin's lymphoma. And he had been gradually getting worse, and the doctor asked me to take a look at him to see if he could get sort of a multiple approach to the particular problem. And it was very interesting. Wherever he had a lymphatic nodule, I could find a muscle that was weak that responded to gentle manipulation of that lymphatic nodule.
Minor surgery.
And as a result, by trial and error, naturally, you're not going to do heavy manipulation on a patient that has Hodgkin's, but a very gentle manipulation of the nodule, and I would test a number of muscles, and that's how finally we found, for example, where the reflex was for the teres minor, where the reflex was for the sartorius, the adrenal, and all that sort of thing. And it was on that particular young man that we learned many of the reflexes, and he did very well. He had one lung that was completely solidified and cleared, and did very well until he went up north and had someone who was a pop and pray, rub and hope specialist, and said, you can't give an adjustment wrong to someone, and proceeded to do exactly that. He soon deteriorated and went right down the drain and eventually passed on. Now that may have occurred despite what happened, but I felt that the early effect of helping that lymphatic system plus making those discoveries was very important. And that's how really the accurate description of the Chapman reflexes and their correlation to muscle testing came about.